North Dakota, and welcome to today's press briefing. We'll want to jump right into the net case breakdown for the day. We're at 665 active confirmed cases for the day, or for right now in North Dakota, 1,712 cumulative over time, and 1,007 that have recovered. So again, the numbers have recovered, moving well ahead of those that are still active, which is a good thing. And hospitalizations at 38, which ties our all-time high, but again remains very low. No new deaths today, which is good news. There were a couple since our last press briefing on Monday, and so deaths now top 40. And again, our thoughts and prayers goes out to anyone who's lost a loved one during this pandemic. Today, we also have talked about cumulative North Dakotans. We have tested now over 50,000 unique individuals in North Dakota, which is remarkable that we've accomplished that. And I say 50,311 unique individuals because we're entering into a phase which really started earlier this week from a testing standpoint. The work that we're doing, particularly as it relates to long-term care, where we know we've got challenges in long-term care as the nation does, where when you end up with a positive case in kind of long-term care, and then you've got both residents and staff coming and going back to their homes and families and back in, that it's very hard to try to drive that virus out of those facilities. The key, of course, to doing that is testing, and what we're calling serial testing, which is you test everybody in the facility and you find out on that particular day, and you test all the staff who's positive and who's negative. Then you also need to come back and start maybe a week later and then test everybody again to see if you're gaining ground or losing ground on that. That's called serial testing. It's still the same kind of test. It's still a PCR test, nucleic acid test, same kind of tests we're talking about that we've been doing since the beginning here in North Dakota. But we need to go back and test the same individuals a second time and sometimes a third time. So as it has been, when we take a look at the numbers, it's important that we note that the 50,311 are unique individuals. We've actually been doing more tests than that, but we've been testing sometimes the same individuals again, particularly as it relates to long-term care. In the last 4 days, in addition to the tests that were reported in the 11 o'clock reports each of the mornings on Monday, Tuesday, Wednesday, and today, there have been over 2,300 additional tests which weren't reported prior to just now that were performed against individuals who'd been tested earlier. And so again, this serial testing, we'll be tomorrow introducing a new way of displaying our testing to help the public understand when we're testing someone who's never been tested before versus testing someone who is a part of a serial testing operation. And it's important that we all learn this difference, because going forward, as we try to chase down the virus, particularly in hard to rooted out places like long-term care, more and more of our testing may be individuals who had been tested prior. Healthcare workers, for example, may, if they're getting tested every week, if they work in a long-term care facility, would be part of that, and we'll try to make sure that we've got good clarity and transparency for everyone having done that. Now, having said that, in the last few days, where we had the significant increase in serial testing that was not being counted in our denominator, not only we were understating the total number of tests that were being performed by our labs every day, we were overstating the percent positive rate in the last couple days, and so that is good news. But what we do know is for sure is that we continue to remain the 5th lowest rate in the country, behind those same states, Alaska, Hawaii, Montana, and Virginia, kind of in a band at own at 3.4%. And while the state rate is very low and very positive, we continue to have challenges in Cass County, and we'll talk about that here in a minute. When we take a look at case trends, We can see again here that after a break about a week ago where we started to have recoveries first outpace and now kind of match the new cases, we've been essentially on a flat line or a plateau here in terms of number of active cases, and that's a good thing that in our state that active cases, because the cumulatives will always continue to climb, but active cases are the ones that our healthcare providers and people working on contact tracing and isolation have to manage, and so that really represents the capacity workload, that along with the hospitalizations. But again, we've got tremendous capacity left in hospitalization, and with the actives flat, with us building capability, that's really a good thing. So that's positive. When we take a look at the active cases by county, which I mentioned, again, in Grand Forks and Cass County, 83% of the cases statewide are in those two counties. This is similar to what it was a week ago. And again, I think it was 8 days ago, last Wednesday, when we announced that Red River Valley COVID task force, which we'll be talking about in a moment. But when we know from an absolute cases that of the 665 total in the state, 412 of those cases are in Cass, 139 of those are in Grand Forks County. When we take a look at active case rate by county, the average, again, averages get distorted by the highs and the lows. If you exclude Cass and Grand Forks County and just take a look at the rest of the state, where we're down to, in many cases, a single-digit positive in those counties. So again, it's a great work is being done, and we're fortunate that we don't have multiple areas in the state that we've got to focus on, because most of the state looking really, really good. Those would be, if you take all those, it averages out to 1.5 cases per 10,000 people, which is, again, fantastically and low. And if that was a state by itself, it'd be essentially number one, down with Hawaii in terms of lowest rate in the country. But if we take a look at Grand Forks and Fargo, they're at about 20 and 23 active cases per 10,000 residents. So it's more than 10 times the rate per thousand in those two counties than it is in the rest of the state. That brings the average to 8.7, which is not that meaningful compared to the fact that we just know where we've got to direct our resources, and that's to those counties that are on the Cass and Grand Forks. An update from the COVID-19 Red River Valley Task Force. Again, sure would make sense to everyone. If that's where we've got our most number of active cases and most number of new cases, that's where we have to direct the majority of our attention and resources right now. The work that is done from that group, which convened last week, has developed a very focused testing strategy for Cass County, and importantly, there's been work going on across the border with Minnesota to develop a testing strategy for Clay County. As we learned yesterday at the White House from Dr. Birx, I mean, one of the hottest and outbreaks in the country are in some of the counties surrounding the metropolitan area in Minneapolis, St. Paul. And so know that the state of Minnesota, which has a like all states, got limited resources, I'm sure directing their attention to that part of their state, and we're happy with the capacity we have to try to support Clay County and the citizens of Moorhead, many of which who work, shop, and are deeply connected with the cross-border metro area, including they're working in North Dakota and getting their health care in North Dakota. Long-term care, of course, is also something that spans across the border. And one of the things as we dig into this, we know that many times there might be people who work in, say, roles, whether food service or custodial roles, may work in multiple long-term care facilities in the Fargo metro area. This is, not likely in the communities, rural communities, where if there's only one long-term care facility for some distance. But when you've got facilities that are close by, you may have someone that who's seeking additional income, maybe working part-time at two facilities, for example. And again, this is something we're really trying to understand through the contact tracing to find out, how it might be spreading from facility to facility. As we ramp up the targeted testing program that I've talked about, again, our plan is to try to do at least 1,000 tests a day as part of the Cass County testing, and the and some of that will include serial testing, so we'll be breaking that out again, particularly if we're doing tests of long-term care health workers on a regular basis. But as we do this, it's possible that we're going to continue to see the numbers rise in Cass County, or we'll see them just remain at these higher levels. And I want to assure people that this is I want to say part of the plan, but if we're going to really control the virus, we need to know where it is, and the way we find out where it is doing really focused and targeted testing. And the best place to look for the virus is in places where it already exists. So if you've got someone who's tested positive, our contact tracers are looking at their other family members or close contacts that they work with. And again, if we know that it may leave a long-term care facility, go home with a worker, and then that co-worker works in has another job. Most families in North Dakota, both parents are working, then can it jump through that home back into another workplace. And again, we know that Fargo's got the highest number of manufacturing jobs in any county in the state, and we have seen that there have been small initial outbreaks in a few manufacturing facilities in Fargo, and again, working really closely with those employers to try to avoid any kind of large-scale breakout. And again, we want to thank those business owners and everybody who is working and collaborating, whether it's the city leaders in Fargo and West Fargo, Cass County Public Health, Mayor of Moorhead, the Clay County Public Health, all of the people in healthcare providers in the city, and again, employers, whether they're in long-term care or in manufacturing. Again, thank you all for managing that. So again, as I would say to the general public, well, we do need to be concerned about these outbreaks with really the really thorough and robust contact tracing. We are able to identify where these outbreaks are occurring and track them down. And again, that allows us to do targeted isolation in a way where we can keep our economy opening up in a smart way while we're still keeping the virus under control. And again, this is about managing risk. It's not about eliminating the virus. And I'd say, again, we have to just make sure that we're managing the risk in the best possible way. And the way to do that is with the tools that we're building, including stronger and more testing, more robust contact tracing, and again, the targeted isolation. We also know that there are other communities which are at risk. We've talked before when Chris Jones has been here talking about anytime we've got congregate settings for shelter, whether that's for domestic violence, whether that's for those that may be disabled, or whether those that are homeless. And we do have a mobile testing team that we're standing up and operationalize that's going to help identify. And when we say mobile, that could include people that are doing outreach even on foot into the homeless community. We've talked about the family health care in organization in downtown Fargo, which again, their mission as a nonprofit health organization is to serve those vulnerable populations, including the homeless, and their testing site opened today. They're set up to be able to do about 50 tests per day. And again, for the general public that may have reached out to them, these are for individuals that have limited resources or the existing clientele. Other individuals, if you've got health insurance or an existing provider or anybody else that your regular doctor, just contact those or contact any of the providers and find out what's the best way to go get tested, because the testing is available through all the medical providers across the state of North Dakota. We're also working again to get more contact tracers getting a dedicated set team of epidemiologists to analyze the Cass County results, and then from those results make even more targeted testing recommendations. And then again, we've also, that group is working to form subgroups to develop wraparound services and care packages and educational materials, and we'll review some of these at tomorrow's briefing tomorrow. And then again, working with businesses that have turned out to have multiple COVID positive cases to have guidance for them relative to disinfecting workplaces and making sure that they're following all the North Dakota SMART guidelines for operating. And while Cass County is our focus, we still have vulnerable populations across the entire state. I think we're close now to 50 long-term care facilities out of 218 across the state that have either a positive individual or a positive resident or a positive staff member. And it's important that we're going to continue to do testing broadly across state to make sure we're not missing any hotspots, because this highly contagious virus has the ability to pop back up again, particularly in vulnerable congregate settings. In the meantime, everyone can help do their part to slow the spread, which we've talked about, the North Dakota SMART guidelines, whether that's maintaining physical distance of 6 feet away or more, avoiding congregating in common areas, even when you're, in getting out and enjoying dining or public areas, washing your hands frequently, using hand sanitizer, and staying home if you feel sick. And again, encouraging people to wear masks, including cloth masks, as a way to help slow the spread or help prevent you from catching it. Quickly on the White House visit, yesterday Commerce Secretary Michelle Comer and I had the honor of visiting the White House to meet with President Trump. Along at the visit also was Interior Secretary David Bernhardt and Dr. Deborah Birx, who's the White House coronavirus response coordinator. And as part of pre-meetings, there was other individuals that we had a chance to connect with at the White House. And also attending the meeting, Senator John Hoeven from North Dakota, Colorado Senator Cory Gardner, and Colorado Governor Jared Polis. In the meeting, as has been reported, we had the opportunity to share information with the President regarding our response in North Dakota to our approach to saving lives and livelihoods, and also to share our gratitude to the benefits of the ongoing state and federal partnerships. We were able certainly to thank the administration and the President for all of the resources that have been provided, and to talk about ideas. After the press left, we had an opportunity to talk more about some of the challenges that we're facing going forward in ag and energy and in long-term care, and had a good roundtable discussion with the above participants. But just quickly, in terms of what North Dakota has received in terms of the federal aid that's come through with the support of our congressional delegation, Senator Hoeven, Senator Kramer, and Congressman Armstrong, as part of the COVID-19 response, which is the economic impact payments, or the $1,200 per person, as it's sometimes known as. There have been 287,000 of those economic impact payments, which totals over $510 million to eligible individuals in North Dakota. And of course, some of that would include the dollars, for children as well. More than $1.7 billion in loans to over 18,400 North Dakota small businesses through the CARES Act. The $1.5 billion, which was directed directly to the state from the Coronavirus Relief Fund for the state to apply against this both health and economic emergency, of which over $500 million of that was approved last week by the State Emergency Commission, which of course includes 4 legislators on that group. So again, we really appreciate the collaboration we've had throughout this with the legislature as we've looked towards directing those dollars towards the most important areas of relief. And separately, outside of that $1.25 billion, there's $62 million that came from CARES Act to directly support K-12 and higher education. Also, there's been the suspension of student loan payments, waiving of interest, and that's gone on by the Bank of North Dakota. And then also, just in terms of material for our medical cash, through the federal government, the state has received over 100,000 N95 masks, 1.5 million surgical and procedural masks, nearly 55,000 eye and face shields, 600,000 surgical gowns, and over 42 million surgical and exam gloves. So again, as fantastic partnership between the feds and the state, and I certainly appreciate the federal government understanding the approach that the way to manage this, because each state is different and each state has the ability to make decisions that work best for their own citizens. We're grateful for the support of the federal partners, but we're also grateful that they're allowing the states to determine their own destiny as they deal with this. So also want to thank, as grateful as we are to all those federal partners support. Certainly don't want to miss the chance to say thank you, as I did yesterday in D.C., to all North Dakotans, because it's North Dakotans exercising individual responsibility and practicing the North Dakota SMART guidelines who are really central to helping slow the spread and enable our strong response and allow us to have such a positive numbers compared to virtually every other state, and do that in one of the least restrictive ways from a government mandate approach to almost any other state. So again, way to go, North Dakota. And I have to say, on behalf of Lieutenant Governor Brent Sanford and myself and the First Lady, it's always an honor to represent the people of North Dakota every single day. But on days like yesterday, when we can share the great work that's going on here, it's especially meaningful to be able to represent all of you. Next topic, schools facility update. We made announcements last Friday. We published guidelines, and well, I think the guidelines in written form may be clear. In the executive order that I signed on Monday related to school facility access, there still are questions on that. So we'll continue to make sure that we keep updating and posting FAQs to make sure everybody understands what those guidelines are. But there was some confusion. We'll talk some more tomorrow when we talk about large gatherings. But let me just clear up a few points today for those that might be listening related to K-12. And again, we recognize the importance of co-curricular, extracurricular activities is central to the well-being and mental health and physical health of students and staff, especially during this current pandemic. And again, trying to balance that as we work to keep North Dakotans safe. So to be clear, the access to K-12 indoor facilities in state K through 12 public schools remains closed except for the 7 uses specified in the executive order. Those 7 uses are that they can be used for standardized testing, for college admission and scholarship eligibility. And Superintendent Basler walked through all the folks that would be affected by that, because hundreds and hundreds of people that had their ACT and other work keys tests and others that were postponed, and we want to make sure people have a chance to do that. So if you need to use a gym, for example, and set it up with the appropriate spacing, that can be used for the standardized testing. After June 1, childcare programs that were licensed by DHS, that's eligible. Summer student center programs, eligible. Summer school classes, those are eligible. Extended school year programs, those are eligible. 21st century community learning programs and Head Start programs, those are all specified uses that school buildings can use for starting on June 1. We also, there's some confusion because, again, school buildings are available now May 15th. That'd be tomorrow, May 15th through May 30th for the dropping off of equipment, whether it's devices like Chromebooks or whether it's cleaning out your locker. Schools are available, and again, encouraging schools to not have everybody come at one time. I'm sure nobody would do that. It would be, bring people in phases, keep distance, and do that in a smart way to keep your students and your schools in good shape as we head into their uses for the summertime. In some cases, there's memorandums of understanding, an MOU or a joint powers agreement between a school board and a city commission and a county commission or a park board. Say if there's a pool that's shared by the outdoor pool shared by a school, then those decisions about opening up those should be made at the local level in conjunction with the North Dakota SMART guidelines for large gatherings that we'll be releasing tomorrow. Access to K-12 outdoor facilities such as track, soccer, baseball, football fields, school playgrounds, green spaces. Again, those outdoor spaces can be decided at the local level, and North Dakota SMART guidelines apply and should be followed for any outdoor facility, and you can find those guidelines at ndresponse.gov. So again, more clarity tomorrow, but again, there are schools are open essentially starting tomorrow through the end of May for closing out the school year. They're open this summer for this already approved 7 uses that are specified, and then some of the outdoor spaces can be made at the local level, and we'll continue to take feedback from school board members and superintendents about additional additional uses that could be done in schools this summer as well, and we'll take that, and of course we can keep modifying and loosening up some of these restrictions, and particularly think about that in the parts of the state where we have almost no or zero positive cases. That would make sense. Again, that's why there's going to be some local decision making involved as we open some of these back up, because it may make more sense to have this kind of flexibility in a county that's never had a positive case versus, say, at a school that might be in the center of Grand Forks or Fargo, where we're still actively in the battle against the pandemic. Next topic is elections. And this is just a reminder for everybody that is tuning in today that we do have a primary election coming up on June 9th. One of the foundational freedoms that our country has, of course, is the right to vote for all eligible voters. And I'm sure that there are some folks who may have had a disrupted senior year, and this is the first time they've turned 18 since the last election, have a chance to vote. So again, I would encourage, even if you've been busy wrapping up your senior year, you're thinking about graduation, if you've turned 18 and never voted before, here's your chance to vote. And but this one is going to be a little bit different because we did early on in this, because of the time frame that was set up in state law. I believe there's a minimum of 40 days required to identify polling places. Back at the beginning of this, when there was uncertainty and concern about the age and vulnerability of poll workers who might be sitting there for 8 to 10 hours, with hundreds and hundreds of people coming through in close contact situations, we gave all county in the state at the county commission level, gave them the ability to choose to be able to hold their June primary election entirely by mail. And as it was, all 53 counties in North Dakota have convened, they've all met, and all 53 counties have decided that they are going to have a entirely mail-in election in June. Prior to this, there were 33 counties that had mail-in elections, and in the prior law was that you had to have at least one polling location. The data would show that in those 33 counties, which represented about 22% of the voting population of the state, about 75% of the voting occurred by mail, and about 25% people still came in on election day. And so again, as we know that there are some counties that are more familiar with the mail-in voting. We know others that may have, for whatever reasons, work, travel, may have always gone for years voting by absentee ballot if they knew that they're going to be out of state or out of town on the day of the election. So this is very similar. If you voted by absentee before, you're familiar with the process. If you have voted by mail in one of those 33 counties out of 53 that had mail-in elections before, you're familiar with the process. But it's relatively simple. It's 3 steps. One is you fill out your application, and eligible voters must fill out and complete and return to their county auditor an application to receive a mail ballot. Those applications have been mailed broadly to eligible voters across North Dakota. Hundreds and thousands of those letters have gone out. If you're an eligible voter in North Dakota and you've not received your application for a mail-in ballot, then simply you can go to vote.nd.gov and complete the online form. And when you complete the online form for absentee or mail ballot, you then have to print it out. And so you fill it on, you print it out, and I guess you could just print it out and then fill it out by hand. You could do either of the way you could do that. But anyway, you've got to fill it out. Then you have to mail it in. And so once you mail it in, then they will mail you a ballot. And then once you get your ballot, it's received back to you, then you need to vote. And then once you vote, fill in your form, then you can submit your mail ballot back to your county auditor office, or there's going to be drop boxes where people can drop them off if you don't want to pay postage, or you want to just come by. Those drop boxes right now they're going to be identified by your county auditor, and they're going to be open up till 4 p.m. on June 9th. You can even track the status of your ballot on the Secretary of State's website at vote.nd.gov to make sure that your ballot made it in. So again, wanted to thank Secretary of State Al Jaeger and Jim Surrum, his deputy, Attorney General Wayne Stenjum, the county commissioners and county auditors across the state, all of the tribal leaders, the North Dakota Association of Counties, North Dakota County Auditors, for helping all the work that they're doing to ensure the right of every eligible North Dakotan voter to be able to cast a ballot while protecting the health and safety of voters and poll workers. And I know that some folks have been concerned about, is this process going to work or is there going to be turnout? But as of noon today, over 128,178 mail ballots have been sent out to North Dakotans who have already submitted their applications. 10,320 of those ballots have already been cast and returned. So the election is underway. And again, if you haven't applied for your ballot, please, again, go to vote.nd.gov and get your form to send in to get your ballot. Still plenty of time to vote, but thank you for participating in one of the most important acts of democracy, voting. Behavioral health update for today. Today, the Department of Human Services and Emergency Services submitted the application to access approved FEMA funding to implement the Crisis Counseling Program, or CCP. The CCP helps individuals and communities recover from natural and human-caused disasters through community outreach and access to mental health services provided to disaster survivors in their homes, shelters, temporary living sites, or houses of worship. CCP grants are awarded after a presidential disaster declaration, and this initial grant applied would provide for funding up to 60 days with an option for an additional funding for up to 9 months. And those services can include individual and group counseling, basic supportive or educational contact, community network and support, assessments, referrals and resources, development, distribution of educational materials, media and public service announcements. Services will transition from the temporary crisis counseling program fund to existing community resources as the program phases out. For more information about the crisis counseling program or other behavioral health services available in North Dakota, be sure to visit behavioralhealth.nd.gov. Your whole health matters, not just your physical health, but your mental health and all the other challenges you might be facing during this crisis. So again, lots and lots of resources out there at the behavioralhealth.nd.gov. If you haven't been there, take a visit and see what resources are there to help support you through this incredible historic time. Closing out with some good news and some gratitude. Last night, again, our team at Job Service, who continues to work diligently on so many different fronts. I've shared before about our aging mainframe that was there driving the traditional unemployment benefits. So much work has had to be done to develop the software and the programming for the new programs that were put in place just over a month ago by the federal government, including the Pandemic Emergency Unemployment Compensation Program. This is the program that allowed an additional 13 weeks of federally funded benefits to unemployment insurance claims of individuals who would have exhausted all of their state unemployment insurance benefits. Typically, this went to people that were seasonally unemployed and then might have gone back to work, say in construction this spring, but was delayed because of their jobs returning might have been delayed because of the pandemic, and their unemployment insurance would have before discontinued. So this was a bridge program that allowed the additional 13 weeks, all federally funded. But with this, it required a complete sort of rewrite of a new software to get this done, and the implementation is now up and complete, and this makes North Dakota one of the first states in the nation to get all 3 programs in place and operating. Across all the programs, Job Service has now paid out $236.3 million in benefits to North Dakotans. We know that for those people that are there receiving these benefits, you'd rather be working and you'd rather be doing what you were loved to be doing before, but we're pleased that we've been able to respond. And again, thanks to everybody at Job Service to make sure that these federal benefits are getting out to our citizens during this time of economic challenge. In terms of gratitude, closing out, we've had thanked a lot of different groups, but it is timely that today is World Facility Management Day. And we want to take a moment to thank all of the hardworking women and men who take care of both public and private buildings across our state. One of the things that we know, a pandemic like this likely going to change everything. It's certainly going to change the way people think about facility management in terms of infection control, in terms of cleanliness, in terms of everything we do. I think many people will they go into crowded buildings, they're never going to quite look at a door handle the same way in terms of recognizing that might be a surface that could be spreading the virus. And so again, we know that the great work that's being done by all the people that work in facility management is helping to slow the spread of this virus, and in doing so is likely helping to save lives, particularly if these people are working in custodial services, the custodial services that were related to healthcare, whether it's our healthcare system, our long-term care facilities, where again people are working extra hard to make sure that we can control the spread of this infection and this virus. And again, I want to say small correction, apparently World Facility Management Day was yesterday, not today, in case people were really tracking that closely, but we'll turn it into World Facility Management Week. So again, thank you everybody that's doing that. I particularly want to say thanks to everybody that works across the state facility management. The state of North Dakota manages over 24 million square feet. One of the things coming out of this pandemic, like a lot of businesses, we may realize that with the success of people working remotely, we may not need all that square footage. That could be one of the shifts that occurs in our country coming out the backside of this. But again, when our team is working here late, we know that some of the folks that are here every single night in the Capitol are part of the facility management team. And I have thanked a lot of them personally that I run into, but I want to thank all of them across the state of North Dakota for the work they're doing, whether it's in universities, whether it's in K-12 buildings, or whether it's in state agency buildings, because again, doing great work to help keep COVID-19 out and keep everybody that's delivering government safe and healthy. So thanks for all you do. And then lastly, on gratitude, quote for the day, Fred Van Amberg, gratitude is a currency that we can mint for ourselves and spend without fear of bankruptcy. And this fits into the understanding that gratitude is something that is unlimited. It never runs out. If you share it, there's always more for you to share the next minute, so you don't have to think about this as something that has scarcity. And at a time when many people are concerned about their finances or their jobs or their futures, I thought this was very fitting. Again, gratitude is a currency that we can mint for ourselves and spend without fear of bankruptcy. Thank you, Fred, for those words. And with that, we'll stand for questions. Got Dave was first up, and then we're going to go online.
Governor, just to clarify, when you went to Washington, D.C., did you have an ask for the federal government as a whole?
We did, because we've been in ongoing discussions with Dr. Birx regarding testing plans that we've talked about, and those include what we're doing with vulnerable populations in long-term care. It includes what we're doing with our partnerships with the tribe, and we did brief her that we are likely one of the first states going across a border where we're doing active assistance to help with our neighbor in Minnesota and across metro area, and we know that there's going to be action taken there. Dr. Redfield from the CDC working remotely, he wasn't there, but they're in close collaboration. So we know that from the CDC team that was here in North Dakota earlier, that there's going to be follow-up that's happening. Dr. Birx took some action items. We know there's going to be some follow-up on that front. we also had some discussions about long-term care and CMS, which is the Medicaid Medicare group led by Seema Verma. Seema, again, in the White House, they're practicing distancing. So Secretary Azar from Health and Human Services and Seema Verma were not present in the White House yesterday, but we have a call with them tonight at 5:15 as a follow item up from one of our asks that we had yesterday. But we're, I'd say, relative to other states who may have come in with some, very basic. I listen to all the governor's calls, and a lot of other states are like, we need help on testing. We need help on testing. I mean, we'd moved up to this spot where we're battling for the number 2 spot in the country. So I think we were able to move past some of the hey, we need swabs and we need medium. I mean, the kind of things we're hearing. I mean, we're sort of moving past that and getting into the how do we go to the next level? And so I felt good about where we are. And again, we were able to direct those requests at the secretary level and not have to make those requests directly to the president. We did in the closed session after the press had left. We did have a good discussion about long-term care with the president. And so again, I think he's aware. And certainly supported the idea of let's make sure we have a call with North Dakota tomorrow. So support from the president about why we're having this call tonight. So I'd say everything that we got from the meeting, from our standpoint, the meeting was fantastic, and everything we went there with asks are all moving forward. Okay, online.
Mike Smith, 660 KUYZ in Williston. Have you been tested recently, or do you plan on being tested following your visit with the president? And what would you say to those who feel it was not North Dakota smart to travel to the White House?
Well, multiple questions there. I've now, a week ago when I got asked this question, I hadn't been tested. Now I've been tested 3 times. We had a report of someone in the Capitol who was positive, who'd been in one of the meetings that I was in, an industrial commission meeting. And so so I got tested following that, tested negative. And then we knew the White House, you don't get to have a meeting with President Trump and the senior officials unless you go through testing. So we knew that we were going to be tested upon arrival as a standard protocol for White House visits. But we thought it wouldn't be a good use of time to fly all the way to DC to get tested. So those of us that went got tested the day before. And so we tested negative the day before, then went on the trip, tested negative when we were at the White House. And so I've been tested 3 times in a week. And so I'm 0 for 3. And I guess this is on the score you want. I don't know. This is not on a batting average. This is one where you want to have a 0 batting average. So far so good. When you say why not smart to go there, I think again we took precautions. We wore masks from the airport into and through the White House. Everybody in the pre-meetings had masks on. The only time the mask came off was actually when we were sitting, as you could see in the visuals, socially distanced, all very spread out across the cabinet room, more than 6 feet apart from each other, and masks were off during the time when we were having a conversation with the president. And of course, he's comfortable knowing that everybody in the room had tested negative. And then when the president left, masks went back on again, and we wore them back to the airport. So I feel like we followed all the North Dakota SMART guidelines and more in terms of how we conducted that meeting. Okay, I'm going to go Amy and then Lane.
All right, so Mike stole part of my question, but the mask that you wore, it looked like it was green and maybe made out of fabric. Did somebody sew it for you?
It was a gift I received a few weeks ago, and it was a NSU Bison mask. And of course, that led to a good conversation with the president about the NSU Bison, because he had invited this year's championship team to come to the White House. That meeting was never was in the process of being scheduled when the pandemic hit, and he mentioned before the meeting got started that he would love to reschedule, love to have the team back sometime, and then that led to a discussion about, could NDSU have beaten LSU, which then, and he was quite impressed with Joe Burrows from LSU, and then we had an opportunity to remind him that Joe Burrows started his football career in elementary school in Fargo, and so that we're going to take credit for the two top quarterbacks in the nation, both Trey Lance and Joe Burrows. So that was fun. But the president did indicate that he had watched the championship game on TV, and I know that was the case from the year before, and so it's nice that we've got a Bison fan in the White House.
On a slightly more serious note, you said that after the press conference, one of the topics that you spoke to the president about was energy in North Dakota. Can you just talk about what your message was?
Well, as I think on the recorded part, the president follows markets closely, and during the meeting when the press was there, I mean, he was current on what the price of WTI was yesterday. He mentioned that in his remarks, and so he follows it very closely. He understands, and obviously he's been a huge supporter and proponent of energy security for the United States, and he understands that there's been a lot of demand destruction with the slowdown in the economy and airline travel and gasoline consumption, and understands that we have to get demand up and get prices up, or we're going to continue to have wells that are being shut in here in North Dakota. And that was, again, one of the things in the pre-meeting. Of course, Secretary Bernhardt from the Secretary of Interior managed. That includes all of BLM and includes BIA, and Mark Fox had reached out before, and again, I made sure that Secretary Bernhardt understood that the importance of energy to North Dakota, also the importance of energy to the MHA nation, and that any relief that we could potentially get through there. Talked about different ideas they're thinking about, whether it's BLM or BIA or other approaches that they're taking, but good discussion. Everybody understands that there's real challenges there in the energy world. Lane, and then Jacob.
Governor, I'm glad you guys talk about your NDSU Bison with the president.
Thank you, Lane. I made sure that the mask was set right out there so that it could get on national television. So I said the team couldn't be here, but we wanted to make sure that at least we got the logo in the White House.
My question is regarding, there was a preliminary test that came out from New York University saying that 1/3 of the Abbott tests had missed positive traces in their COVID-19 testing. Was wondering if you knew a percentage of what tests North Dakota does through Abbott, and if there's any concern that these tests might be faulty.
Well, I'd have to drill down on your question a little more, because the only place I've heard that there was issues was not, because there's two main platforms that the state has from Abbott. One's called the Abbott M2000, which is a high throughput machine that we have in a lab and run in a controlled environment. The second is the Abbott ID Now machines, which have received a lot of attention, and the federal government bought up all the remaining Abbott ID Now machines. They distributed 450 of those to Indian country. A number of those ended up in North Dakota. There was 22 of those machines in North Dakota prior to this, and they're a really small little compact machine that had traditionally been used in a doctor's office for what was called point of care or POC testing. So if someone said, hey, I think I've got strep throat, I mean, you take the test, and then without a hood, without a lab, you put it in, the box closes, and that becomes the CLIA. CLIA is the Certified Lab Institute of America, I believe, are the initials, but they require certifications for these. But that little machine had a CLIA waiver, which made it more expensive because you could run it outside of a lab. Where the discrepancy, as I heard from a prior meeting with Dr. Birx, the discrepancy on added accuracy, where people were collecting tests, transporting them for a long period of time, and then trying to run them through Abbott ID Now point of contact machines. So collect a test, transport it hours, and then run it. And that can work if you've got the transport medium for all of these, whether it's Panther, Thermologic, or M2000 machines. Apparently was not working on some of the the ID Now. So the ID Now machines. So they made clear that if you got ID Now machines and they're part of your testing regime, they should be used for point of contact only, which is, take the swab, run the test right there. And that's actually what they're using in the White House. And is at the Abbott ID Now machines, because you get a result in 15 minutes. And so we got tested, we waited 15 minutes, got the results back. And so again, I know that there is a lot of rigor going into making sure that the testing around the White House is accurate. So I've got a high degree of confidence that if those machines are used per how they're both licensed and labeled and proper use, which is at point of care, that their accuracy is really high, because an ID Now machine actually can detect at levels like 6 times, they can detect 6 times less the presence of the virus than even the throughput machines. I mean, so even though it's a small box, they're highly, highly sensitive to detecting viral load. And so I don't have any concerns about how we're doing that here in North Dakota, as long as the people that have those machines, because all those machines are outside of the state lab, as long as people are using them for point of care testing, I don't have any concerns. But on the split between Abbott M2000 versus Thermo Fisher versus whatever, the lab has that information. I don't think we've published that, but for people that are the testing nerds, we can think about sharing that data. I mean, I might be one of those people. I'd be interested in that data. Okay, Jacob.
Data, we understand. When it comes to early on in your governorship, you pushed the Main Street Initiative, which involved building up rather than building out. There are some reports that show that urban sprawl might have actually helped keep cases rather low. Wondering if this has changed your opinion on urban sprawl?
It doesn't change my opinion on it, because my opinion on urban sprawl wasn't about a lifestyle, it was about cost. And if people are concerned, and still are, and will be more concerned in a time of down economy, people are going to be very concerned about property taxes. And one of the drivers of property tax certainly is the linear square feet of everything. How many miles of road and sewer and water and sidewalk, and how distributed you put your schools apart from each other, and how long the bus routes are and how long the garbage routes are, et cetera. So the whole view on the Main Street Initiative and trying to bring revitalization to our communities was really driven by the economic cost, because I think we understate the cost. And then what happens over and over again is that the people in older homes in the older parts of the communities, where there might be a denser collection of homes in the older parts, near the downtowns of our cities, they're effectively subsidizing the new growth on the edge, and that can be proven quite factually. And the subsidies sometimes are quite large. They're just not well understood. And so I'm all for people living where they want to live, but I'm not for subsidizing, I'm not for suburbia being subsidized by the people that have the older homes in the more denser part of towns. I mean, we should fully allocate the costs where they are, and then people can then decide with a full cost allocation what choices they want to make. But I think in terms of the density, of course, you can practice great social distancing and be North Dakota smart in the middle of our most populous communities, and you can be the opposite of that in the most rural of our communities. And so I think it really comes back to individual responsibility that determines, because it's human to human transmission. It's not building to building or road to road or car to car. It's how humans behave, and they can behave well or unwell in this new environment, in any environment. But I'd say by and large, North Dakotans have been doing a great job across the whole state. Okay, I'm going back to online, since there's one person by the computer, but I know there's representing dozens of people with their hand up at all times.
Thomas, Simon, Williston trending topics. With the increased emphasis on the Fargo-Cass County area and an uptick of positive cases, are you considering applying additional restrictions to that area at all? For instance, restricting travel to and from? For
Tom, the answer to that question is no. If we if we didn't have the testing resources, we didn't have the contact tracing, then you might, because then this would be back to this idea of broadly, let's try to shut down the whole economy and stop travel, versus let's be very targeted. And as long as we can keep up with our testing strategies and the contact tracing and the isolation, we can manage this while not putting in additional restrictions at this time. But of course, we reserve, if we have a true hotspot that blows up to national proportions, then we have to use all the tools we have to protect our citizens. But right now, this is something we need to just manage with the tools that we have. And the state needs to understand that where there are positives and we're doing focused testing, we're going to find more positives, and that's a good thing, not a bad thing. I mean, so if we're finding more positives tomorrow in Cass County and more in the day after and the more in the day after, particularly if those are close contacts, and then we can get those people to be isolated, that'll be a good thing. That's the way we wrestle this thing to the ground. Okay, Lane, and then Jacob, then Dave.
Governor, last month it looked like we were well on our way to hitting our goal of 2,000 tests a day. Now we've kind of dipped in the numbers, and earlier this week we even went below 1,000. Are we still on track to be hitting the 4,000 a day goal and then later on the 6,000 a day?
Well, I've expressed my concerns to the team about making sure that we can get to those higher goals. I think what I said at the beginning of this meeting, when we know that we've got 2,300 tests minimum that weren't counted in the numbers that were released, because those were tests that were completed and performed. So if you add, over the last 4 days, if you add roughly 600 tests a day to the last 4 days, we were above that 1,800, 2,000, so we were close, not where I'd like to be at all. And certainly we've got more work to do if we're going to get to the 4,000 and the 6,000. So this is I would say, absolutely among the highest priorities of the unified command, of the testing team, the contact tracing team, is we've got to build greater predictability, greater capacity, greater data reliability through all this. So even though we've again moved up the leaderboard, we've still got work to do, and we're not letting up on this one.
If I can follow up on Lane's question, then when it comes to data reliability, is it still a question of having the infrastructure in place to do those tests, or is there kind of still a demand problem?
Well, I think with the targeted testing plans that we have in place, and with the Red River Valley COVID Task Force and the really targeted Cass County, I mean, we've got plans to just in Cass County do more than 1,000 tests a day. So we are going to be identifying and inviting people. We do want to encourage people across the state, because if you're unwell and you're in one of these counties that's got 1 or 2 cases or 0 cases, if you're unwell and symptomatic, we strongly encourage you to go and get tested. We know that there are testing supplies available throughout the state. So again, we would love to see the inbound numbers stay high as people as people across state, if you're symptomatic. If you're not symptomatic, but you have reason to believe that you've come in close contact with somebody that has been positive, we encourage you to get tested. And if you're somebody that is, particularly if you work in long-term care and you've got any doubt whatsoever, and you work in long-term care and you're one of these communities, please call somebody up and get tested and get a result before you go back to work. Because once we get one person who is, maybe they did travel to Fargo, maybe they visited their grandkids and everybody was well and they were all together for Mother's Day. You can be asymptomatic and carry this thing, and then all of a sudden now we could be battling a hot spot in a county. I think back to Grand Forks for the first 3 or 4 weeks was one of our lowest in the state when the people in the west had high numbers, and then Grand Forks became the number 1 hotspot in the state. Now it's back down again to sort of the number 2 spot, and Cass County's up. That doesn't mean that a county in the rest of the state couldn't step back into having a problem. I mean, we have to understand that it's not going away. We're just learning how to better deal with it. So again, we would encourage people to help us keep that inbound testing up, and then we're going to focus a lot of our outbound testing in areas where we've got known positives. For right now, today, that means Cass County. Dave?
To follow up on the same thread, If you get to 4,000 or 6,000 tests in North Dakota, are you confident that the lab capacity is there?
Well, we have a couple things. One is to get to those higher numbers, we're going to have private sector partners. I think the numbers are flipped. In most states, the state lab is doing the smaller percentage of the tests. We've looked at some other states, and state labs might be doing 20 to 25% of the testing. In North Dakota, about 80% of the testings come out of the state lab. So our state lab has been heroic in terms of what they're doing. The National Guard team members that have come over there, without them, we wouldn't have been able to get to 3 shifts a day at more than 3 times the capacity. But for us to go to double again and then double beyond that, it's going to take some private-public partnerships. In most other states, I mean, if you're Minnesota, you've got Mayo. South Dakota's got the Sanford lab. We did not have a large medical lab in our state. We had university labs in the state lab. So the other thing, which I think the White House and others are it's quite remarkable, that a state that did not have, like Rhode Island's got CVS there, and that's the reason why their CVS headquarters and their commitment to doing that. You know, we have done remarkably well with showing agility and of a state asset to do that, but we want to get involved in private-public partnerships to get that number higher. And it also makes sense because at some point, whether it's a year or 2 years or 3 years from now, we may not want a state asset that can do 10,000 tests a day when we don't need to do 10,000 tests a day. So again, it would be better for us to be working with the private sector.
Then have you identified private assets?
What's that?
Have you identified those private assets?
Have not. We're having discussions. And we're going to go online, and then I guess we're wrapping it up, says Mike.
Dave Kolpak with the AP in Fargo. Can you talk about the concept of reaching the peak of the virus? Is reaching the peak of the virus supposed to be seen as the be-all, end-all, or is reaching the peak of total cases the be-all, end-all misleading? And what do you say to people who are still nervous about the trend line curving up?
Well, two things for Dave. One is, no, I've never thought, again, I'm not sure exactly what peak he's talking about, because if people just look at a lot of the national press and every day, and they just show cumulative, raising. Well, cumulative always going to go up because it counts every case for all time. I think the important thing for North Dakotans to look at is number of active cases, because that's really what creates the operational workload for us, and it creates kind of the statistical possibility of, are you going to run into somebody who may has it. So for what we're looking at in our dashboard, we're looking at active cases, and active cases over the last 7 days, they've come down from the peak, and then they've been relatively flat. So that's the thing we're really looking at. And then the second part of Dave's question was?
What do you say to people who are still nervous about the trending line curving up?
Yeah, well, the active cases is not trending up, so if people are still nervous about that, I mean, if they're looking at cumulative cases, it's always going to go up. So I would say to people that are looking at cumulative cases, stop looking at cumulative cases. Look at active cases. And if you look at active cases, they're flat, and that should give you more comfort. And then if you're within, any one of the 51 counties that has only 1 or 2 cases, you could work hard to try to run into somebody who is positive, and statistically not. I mean, if it's 1 out of 10,000 people, it might be hard to do that. If you're in Fargo or Grand Forks, where let's say we've got 20 to 23 out of 10,000 people that have the case, then you might say, well, that sounds like a lot because my chances are higher. But again, relative to the rest of the nation, relative to outbreaks, that's A, quite low, and then B, those people aren't just randomly out and about. If they're positive and we've identified them, then they're being isolated. And if they've got people that are family members, then we've asked them to be quarantined. And so again, we feel like that even in a place like that where we're sharing those numbers, it's not the kind of sort of unknown community spread, because again, with the testing capacity and the tracing capacity and then our ability to isolate, that we know where all those cases are, and then we're taking action to stop further spread. So I would again say to people in North Dakota, if you are vulnerable in terms of your own personal health, either because of age or underlying diseases, it's important to maintain caution. For everybody, it's important to maintain the North Dakota SMART guidelines. But I also want to have people to understand that they can have confidence that that we are in a very good spot relative to almost every other spot in the United States in terms of how we're managing this today. And people should feel, as long as they're following the guidelines, they should feel confident, and particularly as we head into summer and springtime, people have every reason to feel good about where we are. But I would say that we're, here at the state, we are taking an enormous amount of seriousness, particularly around long-term care, because we know that that's a point of vulnerability. And so we're going to continue to drive really hard on that, and we're going to continue to drive hard in Cass County to make sure those numbers get down in Cass County and look like the rest of the state. Okay? With that, I think we're going to call it a day. We'll be back tomorrow at 3:30. Thanks for all your time and your questions, and see everybody tomorrow afternoon. Stay healthy. Thanks for being North Dakota Smart.